What's up, everybody? Dr. Rossi, shrinksandsneakers.com. I'm coming back this week with new material throughout the course of the week, so keep an eye out for that. But I want to start with most commonly prescribed psychiatric medications, and specifically I want to dive into a medication that was requested, and maybe not the most commonly prescribed psychiatric medication, but it's definitely one that we use quite often, and that is hydroxyzine or Vistaril. So anxiety. Anxiety is a component of most psychiatric conditions. It's pervasive throughout many of the different types of psychiatric disorders, so we're always searching for non-addicting options for the treatment of anxiety that we can use either alone or in combination with other medications. So here's where hydroxyzine shines in some ways. Now, I'm very familiar with it because it was a PRN or as needed medication that we would use on our inpatient unit for patients who were experiencing anxiety. So this would be on when the person comes into the hospital, provided they don't have any allergy to the medication, and it would be able to be asked for as needed in the event the person was experiencing anxiety, or if they were having insomnia as well. Now, hydroxyzine is a histamine receptor blocker. So it's an antagonist or antihistamine with some anticholinergic properties, similar to another medication you may be more familiar with, diphenhydramine or Benadryl. So the FDA has approved this for several different things. And my personal favorite is this anxiety and tension associated with psychoneuroses. Kind of a weird way of saying anxiety and tension, but this is how the FDA has worded it. Also, other indications include things like anxiety associated with organic disease states, pre-medication, sedation, and anxiety and withdrawal symptoms in alcohol use disorder. So there's a few different places where this works, all of which have to deal with some type of anxiety. I've already told you guys what the mechanism is. It's really basic. It is a histamine H1 receptor blocker, and there's not much else to say about it there. Now, the usual dosing is an important point I want to hit on here for you because it's very important that you be mindful of this, especially for anybody who has a history of cardiac problems or cardiac arrhythmias. So the FDA in the United States here has approved this for 50 to 100 milligrams up to 4 times a day. Now, in Europe in 2015, the European Medicines Agency actually announced that there is a small but definite risk of QT interval prolongation, which could potentially lead to an arrhythmia known as torsades de pointes, or torsades for short. And so they recommend you limit the dose to 50 to 100 milligrams per day. So personally, that's how I prescribe it if I'm using this as a standing dose or standing medication, and the person's going to be taking it on a regular basis. I limit it to 50 to 100 milligrams a day, and that's because of that QT interval risk. You may want to get an EKG on a patient who has a history of cardiac disease and just avoid it completely if there's any history of arrhythmia. If possible, you want to avoid hydroxyzine in the elderly, or you want to limit the dose to 50 milligrams per day, and some of that has to do with the anticholinergic properties, which, although not as bad, it's more selective for histamine receptors than Benadryl is, so it's a better option in the elderly than Benadryl, will cause less anticholinergic side effects. It still has anticholinergic side effects which can cause some cognitive dysfunction, especially in elderly patients and in patients with a history of dementia. You obviously will want to avoid something like this. So that's another place to be mindful of. Now, hydroxyzine is very lipophilic, and what I mean by that is it makes it very easy to cross what we call the blood-brain barrier, and that's going to allow the medication to enter the central nervous system where it's going to work its magic. So that's why this is important and being lipophilic. Now, the other thing to note is the half-life. So how long, if I take this medication, how long is it going to last? Is it going to cover me for the entire day? The half-life is around 24 hours. So you really could do once daily dosing or twice daily dosing if need be. And again, limiting it to 50 to 100 milligrams a day. Now, people are always going to want to know, well, what are the side effects? What are the risks? I'm going to mention the 3 main ones here, and then of course there's a few others that we've already talked about. But sedation, so feeling tired, dry mouth, which is an anticholinergic effect, and tremor. So you want to be mindful of those three things. Those are the most common side effects. It's also contraindicated in early pregnancy, and it's not recommended for breastfeeding mothers. So there's not a lot of data and evidence for talking about the teratogenicity or the risk to a fetus. So you want to be mindful not to be prescribing this to someone who's pregnant or may become pregnant. Now I just want to kind of sum this all up, and I'll say that hydroxyzine, it offers us a medication option for short-term treatment of anxiety that's not addictive. So I think that's where it really shines here as a medication. It still has some risks like we described above, but the medication is good for targeting anxiety. And these medications, and all medications for that matter, that target anxiety really are not meant to be long-term solutions to your anxiety disorder. The goal is that the medication helps to bridge you to time where you are able to better cope with the anxiety, whether that's through cognitive behavioral therapy, mindfulness treatment, mindfulness therapy of some sort, exercise, whatever it is that helps you to reduce that anxiety. Hopefully you can find the skills and tools that work for you so that pharmacotherapy is not the only option for treating anxiety. With that said, I'm going to cut the video there. Drop your comments below. I'm happy to answer any questions about this medication. And please like and subscribe to the channel so that we can keep making content.